Most abundant cation in extracellular fluid is A. Sodium, B. Potassium, C. Calcium, D. Magnesium. And the answer is A. Sodium. The most abundant cation in extracellular fluid is sodium. Normal process of urine output from the bladder is known as A. Enuresis, B. Eliminate, C. Micturition, D. Defecation. And the answer is C. Micturition. The normal process of urine output from the bladder is known as micturition. Hemocephalus occurs when A. Air enters the cranium, B. The patient also has pneumonia, C. The head is tilted below heart level, D. There is raised intracranial pressure. And the answer is A. Air enters the cranium. The most common disorders seen by healthcare professionals are A. Cardiovascular disorders, B. Cancers, C. Skin disorders, D. Sexually transmitted infections. And the answer is C. Skin disorders. The most common disorders seen by healthcare professionals are skin disorders. The valve most commonly replaced is the A. Ileocecal valve, B. Aortic valve, C. Pulmonary valve, D. Hydrocephalic valve. And the answer is B. Aortic valve. The valve most commonly replaced is the aortic valve. Calories means A. Unit of measurement of heat, B. Unit of measurement of weight, C. Unit of measurement of height, D. None of these. And the answer is D. None of these. Calorie is a unit that is used to measure energy. Medial, lateral and collateral ligaments A. Are prone to destruction, B. Are also known as the patella, C. Stabilize the knee from side to side, D. Do not afford any movement. And the answer is C. Stabilize the knee from side to side. Medial, lateral and collateral ligaments stabilize the knee from side to side. The most common reason why amputation is performed is A. Due to peripheral vascular disease, B. Due to trauma, C. As a result of infection, D. Due to congenital disease. And the answer is A. Due to peripheral vascular disease. The most common reason why amputation is performed is due to peripheral vascular disease. Cervical, thoracic and lumbar laminectomy is often performed on A. People who are already paralyzed, B. Those with spinal stenosis, C. People who have a poor prognosis, D. Those who are unfit for other type of spinal surgery. And the answer is B. Those with spinal stenosis. Cervical, thoracic and lumbar laminectomy is often performed on those with spinal stenosis. Potential risks associated with cone biopsy include A. Hemorrhage, B. Cervical stenosis, C. Inability of the cervix to stay closed during pregnancy, D. All of the above. And the answer is D. All of the above. Potential risks associated with cone biopsy include hemorrhage, cervical stenosis, and the inability of the cervix to stay closed during pregnancy. Radiation burns occur as a result of A. High voltage electricity, B. Radiation and acids, C. Sunburn, radiotherapy and radiation, D. Excessive exposure to heat. And the answer is C. Sunburn, radiotherapy and radiation. Radiation burns occur as a result of sunburn, radiotherapy and radiation. During the acute stage of meningitis, a patient is restless and irritable. Which of the following would be most appropriate to institute? A. Limiting conversation with the patient, B. Keeping unnecessary noise to a minimum, C. Distract the person by putting on television, D. Carry out any treatment quickly. And the answer is B. Keeping unnecessary noise to a minimum. Keeping unnecessary noise to a minimum would calm the patient in acute stage of meningitis. Exchange of gases takes place in which of the following organ? A. Kidney, B. Lungs, C. Liver, D. Heart. And the answer is B. Lungs. Exchange of gases takes place in lungs. Which of the following cluster of data belong to Maslow's hierarchy of needs? A. Love and belonging, B. Physiologic needs, C. Self-actualization, D. All of the above. And the answer is D. All of the above. Which of the following is the abbreviation of DROPS? A. GTT, B. GTTS, C. DP, D. DR, and the answer is B. GTTS. The abbreviation of drops is GTTS. In osteoarthritis, cartilage breaks down, causing bones to rub together. This results in all of the following except A. Redness and warmth over the affected joint, B. Pain, C. Stiffness, D. Loss of motion. And the answer is A. Redness and warmth over the affected joint. Redness and warmth over the affected joint is not seen in osteoarthritis. As cartilage deteriorates in osteoarthritis, bone spurs can develop and grow near the end of the bone in the affected joint. Bone spurs are also called A. Osteomyelitis, B. Osteopenia, C. Osteoporosis, D. Osteophytes, and the answer is D. Osteophytes. Bone spurs are also called osteophytes. High levels of uric acid in the blood can result in A. An autoimmune response, B. Sharp needle-like crystals of monosodium urate deposited around the joints, C. Osteoarthritis, D. Rheumatoid arthritis, and the answer is B. Sharp needle-like crystals of monosodium urate deposited around the joints. High levels of uric acid in blood can result in sharp needle-like crystals of monosodium urate deposited around the joints. A nurse obtained a client's pulse and found the rate to be above normal. The nurse documents this finding as A. Tachypnea, B. Hyperpyrexia, C. Arrhythmia, D. Tachycardia, and the answer is D. Tachycardia. It is a transparent membrane that focuses the light that enters the eyes to the retina. A. Lens, B. Sclera, C. Cornea, D. Pupils, and the answer is C. Cornea. Cornea is a transparent membrane that focuses the light that enters the eyes to the retina. The most common cause of hyperthyroidism is A. Graves' disease, B. A toxic nodular goiter, C. A solitary toxic thyroid adenoma, D. Thyroiditis, and the answer is A. Graves' disease. The most common cause of hyperthyroidism is Graves' disease. The best position for examining the rectum is A. Prone position, B. Sims position, C. Lithotomy position, D. Knee chest position, and the answer is D. Knee chest position. The best position for examining the rectum is knee chest position. Who is known as the father of pediatrics? A. Hippocrates, B. Susruta, C. Abraham Jacobi, D. Samhita, and the answer is C. Abraham Jacobi. Abraham Jacobi is known as the father of pediatrics. 1 cup is equals to how many ounces? A. 8 ounces, B. 80 ounces, C. 800 ounces, D. 8000 ounces, and the answer is A. 8 ounces. 1 cup is equals to 8 ounces. The nurse asked the client to read the Snellen chart. Which of the following is tested? A. Optic, B. Olfactory, C. Oculomotor, D. Trochlear, and the answer is A. Optic. It refers to the manner of walking. A. Gait, B. Range of motion, C. Flexion and extension, D. Hopping, and the answer is A. Gait. Surest sign of confirmation of intubation. A. Chest auscultation, B. Chest expansion, C. Visualization of vapor in tube, D. Capnography, and the answer is D. Capnography. Surest sign of confirmation of intubation is by capnography. Endotracheal tube insertion level is A. 5 cm above sternum, B. 4 cm above carina, C. 1 cm above carina, D. At carina, and the answer is B. 4 cm above carina. Laryngeal mask airway is used for securing the airway of a patient in all of the following conditions except A. In a difficult intubation, B. In cardiopulmonary resuscitation, C. In a child undergoing an elective or routine eye surgery, D. In a patient with a large tumor in the oral cavity. And the answer is D. In a patient with a large tumor in the oral cavity. In a patient with a large tumor in the oral cavity, it is not possible to use laryngeal mask airway. Volume of adult ambu bag is A. 500 ml, B. 1000 ml, C. 1200 ml, D. 2000 ml. And the answer is C. 1200 ml. Ambu bag, that is artificial manual breathing unit, is used to ventilate the patient. The adult ambu bag has a maximum volume of 1200 ml. The aim of the airway is A. To prevent tongue fall, B. To facilitate intubation, C. To do suctioning, D. To ventilate the patient. And the answer is A. To prevent tongue fall. The airway is the device used to prevent tongue from falling back to the posterior pharyngeal wall, thus preventing the respiratory obstruction. The purpose of cuff in endotracheal tube is to A. Prevent dislocation, B. Provide airtight seal in trachea, C. Avoiding damage to trachea, D. Make radiological location easy. And the answer is B. Provide airtight seal in trachea. The aim of cuff in endotracheal tube is to provide airtight seal to prevent aspiration. Airtight seal prevents liquids like secretions and any other solids like food from entering lungs. 7-number endotracheal tube means its internal diameter will be A. 6 mm, B. 6.5 mm, C. 6.75 mm, D. 7 mm. And the answer is D. 7 mm. The internal diameter of a 7-number endotracheal tube is 7 mm. The tube number means its internal diameter. So the internal diameter of 7-number tube will be 7 mm. Most commonly used laryngoscope is A. Miller, B. Macintosh, C. McCoy, D. Oxford. And the answer is B. Macintosh. The most commonly used laryngoscope by healthcare providers is Macintosh. Macintosh has a curved blade and is available in 4 different blade sizes. During intubation of newborn to insert endotracheal tube, the blade of laryngoscope is A. Cuffed tube with curved blade, B. Cuffed tube with straight blade, C. Uncuffed tube with straight blade, D. Uncuffed tube with curved blade. And the answer is C. Uncuffed tube with straight blade. In newborn and neonates, straight blade of laryngoscope is required to lift the epiglottis, and the tube used should be uncuffed to prevent trauma to subglottic area, as subglottis is the narrowest part. What ET tube cuff pressure measurement is ideal? A. 25 to 40 centimeters H2O, B. 18 to 30 mm Hg, C. 20 to 30 centimeters H2O, D. 10 to 25 centimeters H2O. And the answer is C. 20 to 30 centimeters H2O. The ET tube cuff pressure must be in a range that ensures delivery of the prescribed mechanical ventilation tidal volume, reduces the risk for aspiration of secretions that accumulate above the cuff, and does not compromise tracheal perfusion. A minimal pressure of 20 centimeters H2O is recommended to prevent aspiration and ventilator-associated pneumonia, that is VAP. Snake bites can be very serious. When caring for a snake bite victim, which should you not do? A. Wash wounds, B. Apply ice, C. Keep bitten part still and below the heart level, D. Get professional medical care within 30 minutes. And the answer is B. Apply ice. Ice should not be applied for a victim of snake bite. Thickest layer of uterus is A. Endometrium, B. Myometrium, C. Pericardium, D. Myocardium. And the answer is B. Myometrium. The thickest layer of uterus is myometrium. Most important drug to control anaphylactic shock is A. Hydrocortisone, B. Dopamine, C. Dexamethasone, D. Adrenaline. And the answer is D. Adrenaline. Adrenaline is the most important drug to control anaphylactic shock. Cause of respiratory acidosis is A. Respiratory failure, B. Drowning, C. Paralysis of respiratory muscles, D. All. And the answer is D. All. Respiratory failure, drowning, and paralysis of respiratory muscles. In autoclave, steam is used because A. It is cheap, B. Easily available, C. Steam is able to penetrate porous material rapidly, D. It does not raise temperature. And the answer is C. Steam is able to penetrate porous material rapidly. In autoclave, steam is used because steam can penetrate porous material rapidly. SLE, systemic lupus erythematosus, is A. An endocrine disorder, B. An autoimmune disease, C. A cardiac disorder, D. An allergic reaction. And the answer is B. An autoimmune disease. SLE, systemic lupus erythematosus, is an autoimmune disease. The condition in which patient has an involuntary grinding of teeth during sleep. A. Enuresis, B. Bruxism, C. Insomnia, D. Cavity. And the answer is B. Bruxism. Features of nephrotic syndrome are A. Edema, B. Proteinuria, C. Hypoalbuminemia, D. All. And the answer is D. All. Features of nephrotic syndrome are edema, proteinuria, and hypoalbuminemia. In the following, which is a developmental disorder? A. Scabies, B. Dementia, C. Autism, D. Schizophrenia. And the answer is C. Autism. Autism is a mental condition present from early childhood. It is characterized by great difficulty in communicating, difficulty in forming relationships with other people, and difficulty in using language and abstract concepts. Drugs that cause expulsion of gas from the intestinal tract. A. Astringent, B. Carminatives, C. Analgesics, D. Emetics. And the answer is B. Carminatives. Drugs that cause expulsion of gas from the intestinal tract are carminatives. Drug of choice for eclampsia disease condition is A. Midazolam, B. Heparin, C. Bitaloc, D. MgSO4. And the answer is D. MgSO4. Eclampsia is a condition in which one or more convulsions occur in a pregnant woman suffering from high blood pressure, often followed by coma, and posing a threat to the health of mother and baby. Drug of choice for eclampsia disease condition is magnesium sulfate, that is MgSO4. Magnesium sulfate is the drug of choice for preventing and treating convulsions in severe preeclampsia and eclampsia. Fridge temperature to store insulin should be at A. 0 degrees Celsius, B. 2 to 8 degrees Celsius, C. 8 to 16 degrees Celsius, D. 21 degrees Celsius. And the answer is B. 2 to 8 degrees Celsius. Fridge temperature to store insulin should be at 2 to 8 degrees Celsius. Protect the insulin from becoming too hot or too cold. Do not let the insulin freeze and become ice. After changing to ice, do not use the insulin again, even if it changes to the liquid form. What is the most common adverse effect of injection linezolid? A. Pancytopenia, B. Thrombocytopenia, C. Calcipenia, D. Glycopenia. And the answer is B. Thrombocytopenia. The most common adverse effect of injection linezolid is thrombocytopenia. Thrombocytopenia is a condition in which your blood has lower than normal number of platelets. A preterm baby is a baby born before how many weeks of gestation? A. 40 weeks, B. 32 weeks, C. 42 weeks, D. 37 weeks. And the answer is D. 37 weeks. A baby born before 37 weeks of pregnancy is considered premature. That is, born